Hi, welcome to our little chat today on our lovely gut health group about histamine intolerance. My name's Christine Barnes, and my clinic is called The Bodyguard. So you can find me on thebodyguard.com.au, on Instagram, Christine Barnes _The Bodyguard. So feel free to post below if you've got any questions while we're having our chat today. So I'm just going to cover some of the basics around the whole aspect of histamine. So let's get started. So a lot of people aren't aware of histamine. So histamine intolerance, which it's commonly viewed as or known as, is a larger subject that can be covered in today's chat. And it's not just about the gut. There are multifaceted aspects that interact with, that reduce, increase, and create histamine as being a problem. I'm only just going to cover an overall of it today. I'll target in on some things about supplementation, what we can do about it, things to watch out for. But let's start with what is histamine. So histamine is an important chemical. It acts as a neurotransmitter, which in itself is very interesting. Well, I think so. It triggers stomach acid to help digestion, so it's not all bad. Mostly we hear about histamine is the negative side of things. It's an essential part of our immune system, responding to pathogens, etc. So that's a very important aspect as well. It's also a trigger for arousal and wakefulness, so making sure that we're awake, and those whole biorhythms that are very important with quality of life that then impact negatively and positively on our health and wellness. It's important that we have enough histamine, but also that we don't have too much. Otherwise, we may end up with some of these symptoms of histamine intolerance. So some of the symptoms, and some of you out there may be experiencing some of these symptoms, but some symptoms are things like food sensitivity, migraines. Now, this is a terrible, debilitating symptom, so something we definitely want to be avoiding if at all possible. And seasonal allergies, rhinitis, so really getting that upper respiratory challenge, overproduction of mucus, anxiety. Now this is something that a lot of people aren't aware of in relation to histamine, that anxiety can be driven partially or in whole through excess histamine production. So you can see that the histamine plays a role in neurotransmitters, and anxiety is one of those symptoms that we can produce if our neurotransmitters aren't managed well, and there often is some underlying reason for that. So hives and skin issues. Now this is a common one. So a lot of people think about hives or that swelling of a skin in an area. That can happen anywhere, skin, face, mouth, anywhere at all. But that's a very common symptom that people think that when they've got that, that they have histamine issues. But that's not necessarily the case. We've got to keep in mind that there's multiple reasons why one can have swelling of the skin, mast cell disorder, all sorts of things, digestive issues. That's what we're all here talking about within this Facebook group, is our digestive issues and how to actually help resolve those. Nausea, of course, that's part of the digestive issue, and that upper stomach. So think about histamine in relation to having adequate, adequate stomach acid. And this is really important for being able to break down and absorb foods, for our nutritional status, and of course histamine plays a role in that. Histamine can also be partnered with hormonal issues, And there is a common issue that when one falls pregnant, if you had histamine issues before, sometimes when we fall pregnant, they fall into the background and are not such a big problem. And this is the hormone relationship to histamine and histamine release, production, and managing histamine. And of course, that can mean that we can also have an inverse relationship with having menstrual challenges. So that's something that we want to be aware of as well. So you can see that histamine can play a huge role in so many different things. Generally, most people relate to histamine as itchy skin, itchy tongue, itchy mouth, itchy eyes. So if you're getting any of those symptoms of itchiness, it may be a histamine management problem. Also, a wide range of mental illnesses are associated with histamine. So this is a really important topic for us to be talking about because, as you can see, it affects so many things. You can also have these symptoms from not having enough histamine. Often we think about them in relation to excess histamine. So like if you've heard any of my talks previously, or if we've had a conversation in a complimentary chat, or if you're one of my patients getting treated by me, you'll hear me talk often about asking questions. What are your copper and zinc levels, for instance? So these are things that when they're too low or too high can affect multiple aspects of health. And histamine is also one of those. So they're things that we can check in on and have a look at. What's your level of histamine in your blood work? So that's an important start. But certainly more important than that is actually checking in on your symptoms. Now, sources of histamine. Now, histamine is something that we naturally produce. It's very important. Yeah, and I'm going to cover what it does and how it impacts even more. But it also is something that can be increased by histamine that's in histamine foods. Now, most fermented foods produce histamine, and smoked meats. So certainly if you're having issues with histamine, these might be the first foods that we look at reducing or choosing or selecting appropriately. Alcohol. Alcohol is a challenge for the gut in so many ways. So certainly gut health can be affected negatively by the alcohol itself. And then there's how the alcohol is made, and then the different types of alcohol. Pardon me. Fish and shellfish, common histamine aggravators, tomatoes, eggplants, any over-ripened foods. So meat, fish, poultry that are not fresh as well. So there's something that early in my career, I found that really quite surprising, that if they're not fresh. So it doesn't mean you can't have fish, meat or poultry that isn't fresh and frozen quickly, and then you want to defrost it quite speedily and cook it quite speedily. So these are processes that affect histamine as well. So in a nutshell, patients with histamine intolerance have either too much histamine or too little, and or problems breaking down histamine. Yeah, some foods can impact because they're high in histamine or histamine producing foods, but also there are foods that can be histamine liberating as well, that can negatively affect you and aggravate histamine-like symptoms. So these are important things. One cause of histamine intolerance is a deficiency in an enzyme called DAO. And when anything affects our availability or blocks that DAO pathway, this can aggravate histamine as well. DAO is the acronym for diamine oxidase. So it's an enzymatic pathway, and it can be blocked, reduced, or affected by a wide variety of things. So let's talk about some of those. Some people have genetic SNPs or polymorphisms that reduce availability of DAO. So they're our genes. Now, if our genes, those genes that are related to that, that are switched on because of epigenetics, so some of us can have those genes. I actually have many of those genes that affect DAO, but they don't actually express because, I'm taking care of myself as well as I possibly can. And I've done that for many, many years. But some people didn't know that certain lifestyle, diet things can affect DAO, and there's many things that can affect it. So if you've got a reduction in DAO, then you're at greater risk of responding negatively or poorly to some of these high histamine foods. So these foods I've mentioned aren't bad, but if you've got a problem with histamine, and in particular with the DAO pathway, you've got a risk of responding negatively to those foods. So if you find that you don't have a problem with histamine, but you only have a problem when you consume some of those foods, it may be the DAO pathway that you've got to work on. And that would be because it's affected to the point where it can't help facilitate the breakdown of histamine. Yeah. Another enzyme involved in histamine breakdown, and some of these I really have trouble getting my tongue around, so forgive me if my pronunciation isn't quite right, because mostly we're using the acronyms with these types of words. So histamine N-methyltransferase. So this can impact by genetics. So HNMT is connected more to do with immunology and mast cells, whereas DAO is more connected to the gut. So you can see that even now we're talking about these two aspects of health. When we take a closer look under the hood, we can see even they're breaking away and they're affecting histamine from different things. So today I'm mostly focusing on DAO because it's very common and it's something that we, can deal with quite commonly and work with. Other causes of histamine intolerance include some pharmaceuticals that block DAO, and a lot of people aren't aware of this. Many people are on antidepressants. When we have antibiotics, heart medications, antipsychotics, diuretics, pain medication, these can all affect histamine and through the DAO pathway by blocking the DAO pathway and making us more sensitive to histamines and intolerance. So, if you're on any of those medications, those pharmaceuticals, it's important that you put things in place to help reduce the negative outcomes. If you've had genetic testing, your practitioner can look at your genes and just see if they're expressing by looking at your symptomology and going, this looks like it's expressing, and putting some things in place to help reduce that expression and help reduce your aggravations and improve quality of life. And then what we want to do is work on why those things are expressing, improve gut health, of course, and also have some first aid available that if something does aggravate you out of the blue, it's really important. High estrogen can inhibit DAO. So here's the hormones affecting. Now, interestingly, gut health affects hormones, affects DAO. DAO, histamine, can affect hormones. So we start getting this confusing mix of things. So again, this needs working out. And when you're looking at things from an individualized perspective, it can be really clear to what degree any of these things may be impacting on your health and wellness in relation to histamine. So alcohol blocks DAO too. So there's multiple reasons why we can respond negatively to alcohol. We can have an inability to break down the alcohol in the phase 1 stage of the liver. Phase 2 can be slow, which is where it binds to the alcohol, carries it out of the body. There's so many different aspects of alcohol and many other ingredients that are commonly within our lifestyle that can cause us to have a histamine response. Keeping in mind that allergic responses quite often are related to gut health and liver as well. But alcohol specifically blocks DAO, and that can have an impact on histamine. Now, red wine is famous for sulfur aspects in it that can create a histamine type response. So again, we're going DAO, alcohol, multiple reasons, that can be playing in. One of the main reasons that causes low DAO and histamine intolerance is gut damage and leaky gut. Now, if you haven't listened to my previous Facebook Live on leaky gut, I highly recommend you do, just as an introduction and to start seeing that all of these things can play a role and start spiraling things down, and they start firing off different aspects. And then it's like, well, what came first? Do I have leaky gut? Do I have DAO issues? Do I have both? And quite often we have a little bit of everything that is going on in many cases. Many of my clinical cases, I see that we can identify multiple things. Often people come to me because I deal with complex health with multiple diagnoses. And then along our journey together, we often diagnose further things that may be involved as well. So it can be very difficult if you're doing your own treatment because, just having the experiences of that skin firing off, and, it can aggravate our anxiety. It can give us some challenges with that, working out what's going on, and can be very confusing, which then can add, stress on top of all of this. And let's not forget stress, because stress can block all of these things, can aggravate a stress attack, can aggravate histamine. Remember, there's a relationship between histamine and mental health, multiple mental health issues. So, one can cause the other and vice versa. So, stress management is so important. And many people get sick of me talking about, well, are you doing a breathing technique? Are you working too hard? Are you doing relaxation things? Sometimes that can be just introducing regular walking. Other times it might need to be a little bit more intentional with breathing techniques. And I have a range of breathing, recorded guided breathing techniques and guided relaxation and some more advanced meditations. So if you're in Australia in particular, I'm happy to send that to you. So please let me know. And all my patients get those recordings free of charge. And of course, you can purchase them as well. Stress management is that important that we want to have all of those techniques available. Sometimes, though, with health, we can get so far with our own treatment or even with a practitioner, and we hit a bit of a wall. And sometimes it's deeper mental health that needs to be looked at. And that's where working with a health team, developing a health team that may be able to dig deeper and look at some of those triggers, sometimes childhood issues, sometimes it's thoughts that we've developed, ways of thinking that we've developed. I know in my health history, I've developed some habit patterns, some beliefs that were not particularly real or authentic, and they needed to have someone call them out and change that. And I know that that helped me make some significant changes there. And there's some fantastic people available these days that can help with online consulting and we have people that we can introduce you to that I work with my patients if needed. But let's get back onto this DAO. It's such a funny thing, DAO. I find it quite fascinating. But one of the main causes that we find in clinic of low DAO, so not enough of that to help process the histamine, is damage to the gut. So when we've got damage to the gut and these imbalances with our microbiome that then can provoke a leaky gut or gut intestinal impermeability, these things in combination can just start firing off and aggravate more of these histamine type symptoms, which are terrible to experience. They really are. Now, DAO is made in the kidneys and in the intestinal lining of the digestive tract. And this is why if we've got damage to our intestinal lining, such as the case with leaky gut, we get these symptoms because the DAO is not as effective and the production of it isn't as effective, and it's not necessarily producing enough to be effective. And we can develop histamine intolerance even though our histamine levels might be fine, purely because of the DAO is not at healthy levels to be able to manage histamine. Remembering, histamine itself is not the problem, it's whether it's too high or too low. It can build up, so we can develop excess just by not being able to break it down. So there are many aspects of that. Indeed, some researchers use DAO as a marker for intestinal mucosa integrity. So that's that leaky gut aspect. So you can see that we're not just looking at an IP or intestinal permeability test, but sometimes we're looking at other tests that are available that also tell us that we've got a leaky gut. So let's talk further about these gut pathogens and a little bit specific in this tiny little window of time that we've got to talk about some of these, what I find really interesting and exciting aspects of health. I hope you do too. So even if the DAO is not affected by leaky gut or genetics, you may still develop histamine intolerance because of your gut dysbiosis or imbalance in the pathogens. So we've got pathogens that live within us, our microbiome. You've heard me talk about that previously. So these are critters, a whole 2 kilos that live within us, and they really run the show. So if we're not caring for our garden of microbiome well, then some of these pathogens that live within us, what's called commensal, they can be opportunistic and get overgrown. So just because you may have had a gut test that has some of these, it's about their level within your gut and also whether they match with your symptoms, and also do you have adequate levels of beneficial bacteria. But I'm just going to highlight some of the gut pathogens that produce histamine. So these aren't all the gut pathogens, but and even this list is not extensive, exhaustive, but these are common ones that are histamine producing. And you may have them at low levels. They may be commensal. You may have adequate beneficial bacteria, and the pattern of your gut may be fine and they may not be involved. So if you do remember hearing these in your gut test result, please don't panic. Please talk to your practitioner further about that and whether these gut pathogens are involved. Now, these pathogens also cause a wide range of other diseases, symptoms, etc. So it may not be producing histamine for you, but I'm going to highlight some of them. Citrobacter freundii. So this is one that is, I'm seeing it more increasingly these days. So I can't tell whether that's just the cases I'm getting, but I am seeing it very frequently. E. coli. Most people are familiar with that, with if you get an infection with E. coli from food poisoning, etc. But it does live within us at low levels. Some Enterobacter species are histamine producing. Halvnia alveoli. Klebsiella. Now, this is commonly associated with respiratory issues and in particular pneumonia, and is a common bacteria to pick up in hospitals, or if you eat a high sugar diet in your history, often this is a pathogen that grows from that as well. Some lactobacillus species. So lactobacilli is a beneficial bacteria. So some lactobacillus species, not all of them, are histamine producing. Proteus mirabilis, Pseudomonas, and one particular species of Pseudomonas. Salmonella, again, you're hearing some of these that are common that are to do with food poisoning. Now, golden staph or Staphylococcus aureus. Staphylococcus aureus or golden staph, they're intermingled, those two names are common. Of course, they're nasty for all sorts of things. And some of the Streptococcus species. So now they're very familiar to me in my clinical work. We often see a combination of, not all of them, but some of them, when we've got not enough of the immune system, keeping them in check, and also when we don't have enough of the beneficial bacteria, or our diet isn't feeding the immune system and the beneficial bacteria adequately, or the diet's feeding the pathogens instead. So there's lots of reasons, as you heard, for having some of these. Now, this list is not exhaustive. There's many others that can be involved with histamine. But this is where histamine can be complex and often needs a multifactorial approach to treatment, not just taking antihistamines. Because sometimes that histamine, if it is too high, it'll move from just producing that itchiness that we commonly associate with possibly feeding into mental health issues, or other things. So it's very important, like everything, to get the good balance of everything. So we're working from an optimal state or level of all of these things, and not just histamine. Often my patients hear me bang on about, let's just check in and see where everything is at, because everything needs to be in that perfect space, perfect level, not too high, not too low, and in good ratio with other things in order to give us resilience. So we can have a stressful scenario, we can eat badly for a meal or a day, and it not negatively impact on us. So that's developing resilience, and that's really our long-term goal with our health. So, as we've heard, it can be from leaky gut. It can be from too many histamine producing foods or releasing foods. Often, though, we see histamine intolerance can develop when we also have difficulties with salicylate foods, phenol foods, and other naturally occurring food chemicals. So, this can be absolutely dreadful for some patients where they've got not just histamine problems, but with multiple foods. But keeping in mind that this is intolerance, it's starting the immune system just firing off over responding to different things, and sometimes we develop what we think are this wide range of food issues, and it's not actually the food that's the issue. It's about this DAO, gut imbalance, intestinal permeability, too much stress, stomach acid too low, all these things playing in. But look, all of these things do need treating, and sometimes we do need to reduce some of these foods that are aggravators, but we want to reintroduce them at the right level, at the right time after certain treatment. Now, because of all that, we can develop SIBO. We've heard about good old SIBO, small intestinal bowel overgrowth. And what comes first, we don't know. Sometimes it's the SIBO that then carries on and produces this. Sometimes it does start with histamine, but just to let you know, you can develop many other things, and it can be a spiraling down. And this is where we really need an individualized approach to bring best outcomes, as no two cases are the same. All of those things that I've mentioned, and again, that's not an exhaustive list, but there can be different levels of all of those things involved, and it might be more of some things and less of others. So if you're finding that you're taking a natural histamine calmer and things are still not improving and your intolerances are becoming worse, it may be time to take a closer look under the hood and see if we can get exactly what's going on and start dealing with the underlying drivers. So let's talk about some of the positive. We've talked about some of the more tragic things and some serious sounding pathogens. So let's talk about how to increase DAO if DAO is part of the issue. And welcome to anybody that's just popped in on the recording at the moment. You can always listen to this as a recording, and please feel free, if you've got any questions related to this topic, to tag me, and I'm happy to try and, if I see it and get time, to comment. And you can always, if you do want to go further with your health and start talking directly with a practitioner, you can always check in for a complimentary chat with me at any time and see if we're a good fit to work together. But today I really want to, talk about what we can do and see if we can look at some of these things that you might be able to do either if you're working with another practitioner or if you're doing your own treatment. So, ways to increase DAO and reduce histamine. Okay, so dietary strategies, definitely something that's very important. So we need to look at selecting foods that aren't high in histamine or aren't histamine creators or feeding into that histamine response in any way, reducing them. And we also need to look at how we're preparing our food. So I touched on that earlier. So we want to avoid or minimize histamine stimulating foods, histamine containing foods, histamine releasing foods, or anything that ties in with that histamine response. You may also want to start to avoid lectins and dairy also if you've got histamine issues, because although you may not have an overt lectin issue, when we're at a certain level of responding badly to histamine, we sometimes respond to other things, as I mentioned earlier in this chat. In particular, lectins might be a problem because they have a tie-in with leaky gut, so they may just be helpful to reduce, maybe just short term. So let's talk about histamine, DAO, and strategies to repair the leaky gut. So some strategies that you want to look at are targeted supplements to change the dysbiosis of the gut in a positive way. Yeah. And we even need to be careful of what probiotics we use, because some probiotics actually increase histamine, some probiotics decrease histamine. So we need to look at not just the families of the probiotics, but the species underneath that as well. I'll talk about that further in a moment. We need to reduce stress, and that's why I, mentioned some intentional stress management, because stress is a little bit more than just overworking or, an annoying partner or something that annoys us and we feel stressed about that or overworking. Sometimes our stress management skills fall into the background, and I cannot tell you, when you're looking enough, I cannot promote enough how stress management, intentional stress management, more than listening to some pleasant music, more than doing some colouring in, but actually doing some intentional stress management techniques to help lower those aspects of stress that really shut down the gut and make you vulnerable to being reactive. So please, ask if you're not too sure what I'm talking about there, but generally we need to do some intentional stress management techniques, and sometimes we need to dig deeper and look at some of those triggers in themselves. So we've talked about food, just taking those out of the picture that are aggravators, and some of the ancillary foods that are not histamine producing themselves necessarily, like lectins. They're not a direct histamine producer as such, but they can make things worse. Dairy can be a direct histamine producer, depending on your dysbiotic picture and arrangement. So strategies for repairing the leaky gut. So we mentioned we've got to change that dysbiotic gut, so that 2 kilos of microbiome, we've got to have that in the right balance, reducing stress, and address SIBO, small intestinal bowel overgrowth, if it's part of the equation. It isn't always. You can test for that. I generally find that it is part of the equation depending on the gut microbiome, because some of the pathogens produce small intestinal bowel overgrowth anyway, so usually we don't need to do a separate SIBO test, because we can, through experience, predict that that's part of the picture as well, so we address that as well. Now, getting pregnant is something that's quite, I don't recommend you do that to resolve this, but it's interesting that it can increase your DAO and reduce or increase your histamine tolerance, therefore reducing intolerance. And we do find that regularly, that patients that go on to get pregnant, even though they had problems with DAO and histamine, often that then is not a problem. But of course, we can't be pregnant all the time. But that's the playing with the hormones. So again, if we find that there's an association with menstrual cycles, we often need to look at, are some of the hormone imbalances aggravating histamine? So, and of course, that's that shift when we go to being pregnant, the hormones change, and you heard me mention how estrogen can play a role in that. So there's some of the things that you may hear me look at and talk about considering if it's part of your case. And it not always is. And that's why we need to check in on all the things that may be involved and get something very individualized happening as far as how to address these sorts of things. I wanted to touch on some general supplementation here about DAO. DAO is not available in Australia currently as a supplement, but it can be bought online. Now, I have to be careful because it's outside my professional boundaries to be seen as producing non-TGA in Australia supplements, but I am aware that we're talking to people worldwide here, and I don't want you to miss out on some of these things. So I thought we'd look at it. Now, there's also a source of DAO from pig kidney extract. So think about that in your diet. And some of my patients, what they do is they get that frozen and they just grate off some of that and add it to all their foods, stews, bolognese, sauces, anything like that. So it can be a supplement that you're taking like as food and incorporating it from that way, from that perspective. But DAO as a supplement comes in a wide variety of names. So sometimes it's called DAO Sin, say DAOSIN, DAO Food Plus, DM Direct DAO, so that's DIEM Direct DAO. But as I say, and some of those are pure pig kidney, so you're just getting the kidney in a capsule. So you can get that. Talk to your organic meat supplier about getting pig kidneys, and you can keep them frozen and literally just grate a little bit into every meal. That's all smoothie. So a lot of my patients do that here in Australia. Now, here's some interesting things that tie in with DAO and the whole histamine picture. It's important to have adequate levels of B12, iron, copper, vitamin C, B6. Otherwise, these are nutrients that support DAO and that enzymatic pathway. So you may have adequate levels of DAO, but you may still be having a histamine response. And maybe it's because you're deficient in some of those nutrients. Now, all of those nutrients can be tested, but also if you don't have testing available or it's not part of your budget, it may just be a good idea to talk to your practitioner about, are there any other symptoms that may suggest some of those nutrients being deficient, and then supplementing that. So so that DAO pathway needs to be supported adequately, and we need to make sure that we're not taking anything to block it. If you are, you may need to supplement to help that DAO pathway work well. But let's talk about some other supplements that are helpful. SAMe. Now, SAMe is very helpful for the liver. So here's other aspects that are coming into play with histamine. EGCG. Now, this is an interesting extract from green tea. Some people are sensitive to this, and again, please, talk to your practitioner and make sure these supplements are appropriate for your case, because there may be other aspects of your case that mean that it's not appropriate. Quercetin, magnesium, there are a lot of different things that need to be introduced, and I'm just naming the highlights and some of the things that can bring some symptom relief, but you might need to go dig a bit deeper. Now, I've talked about DAO as far as frozen kidneys, yeah, and including that in your diet. So the diet can really be helpful, not just by what we're reducing, but green pea sprouts also contain DAO. So if you're a vegetarian and you're having problems with that pathway, you go for green pea sprouts. Now, I often suggest both a product initially and dietary inclusion of those items when I'm looking at histamine, but not necessarily are either of those appropriate for every case. So again, you've got to look at the variances in the case. Let's quickly talk about probiotics, because I know I've gone over time again, but I could bang on about this subject so much. Probiotics, histamine, and DAO. So there is an inverse relationship. So probiotics need to be chosen wisely. Some probiotic strains are good for histamine intolerance and some are not. Generally, the lactobacillus species are not appropriate. Yeah, so interesting. There's some confusing information in there, but it's about species. The beneficial ones for histamine are specifically Bifidobacterium, Bifidolongum, Bifidobrev, Bifidobacterium bifidum, and L-Plantarum 299V. So you can hear I'm getting very specific with strains. Now, I know some practitioners recommend Megaspore Biotic for histamine issues. However, there are two of the strains in that probiotic that are known to produce histamine. So it has a lot of benefits. It's a great probiotic. If you're on that and it's helping you stay on it, follow your practitioner's advice. But I generally don't prescribe it for histamine because I'm looking at specific strains there that are not aggravating. But it all depends on your level of aggravation and, of course, the underlying driver. Now, do remember that probiotics do not necessarily make long-term change to the gut biome. They are more of an ongoing management tool, and this is something that is very important to know. So just winding up, there's so many aspects to this. It is confusing for people, and some people feel that they're doing a lot to help their histamine and not getting the results they want. And that's where we may need to dig a bit deeper and see, is it something else completely different? Mast cell activation. Some things actually present like histamine intolerance and are actually from something else completely different. So this is where analysing the case is really important and seeing where things need to go as far as an individualised treatment is concerned. So I hope that's been helpful. It's obviously, we're just scratching the surface here today, but just throwing that out there for you, that if you've got some histamine type symptoms, we may need to dig a bit deeper. For some people, it may be simple in response, and I hope that's you. But if it's not, please talk to your practitioner about going further and looking at how to actually identify what's driving this, as well as helping with treatment. So I hope you have a great week. I'm really pleased that I've had this opportunity. Thank you so much for taking time out of your day to listen to my rambling about histamine and everything involved. Please do let us know if you're listening live or if you're listening to the recording. I know that Megan's always interested to know what topics are helpful. She and I talk about what you would like and what information you're needing. So please let us know. I'm very privileged to be part of Megan's page here. The gut healing community and support and chat group is close to my heart, and we want to provide as much information and support as you need. So we're here to help. So if you do need to go further and you think you need an individualized approach, pop into my page, thebodyguard.com.au, and you can book a complimentary chat if you feel ready to go further. But if you've got a practitioner, feel free to take some of these thoughts to your practitioner. I'm sure they already know. So sometimes with practitioners, it's about letting them know that you want to go deeper. And I know a lot of practitioners want to respect how speedy the patient wants to go. And, there are some tests that are helpful as well. I mentioned some of those nutritional aspects that may be helpful, just getting a baseline on those because they support that enzymatic pathway. So I'm going to leave you with that today. Have a great week, and I look forward to talking to you very soon on whatever subject that Megan lets me know that this lovely group would love my input on. So I'll be around during the day to chat and respond to any questions that you pose in the thread, and have a brilliant week. Bye.